সম্মানিত দর্শক ও শ্রোতা, welcome from Health Channel. Today I want to explain embryology of the human heart very briefly. Heart development refers to development of the human heart. This begins the formation of two endocardial tubes which merge to form the tubular heart called primitive heart tube that loops separate to form the adult human heart. Human heart starts to beat spontaneously 22 days of the development. Is the endocardial heart tube. After fertilization, modular blastocyst implantation on the first week and second week the bilaminar embryo primitive placenta and the mesoderm develop and the critical period of cardiac development third week trilaminar embryo cardiogenic plate primary heart tube and early separation of atria and ventricle. This right ventricle, left ventricle, pulmonary vein to left atrium from an oval ostium primum, right ventricle and left ventricle. Truncus arteriosus separation, semilunar valve, right arch, an atrioventricular valve, ventricular septum, ventricular septation complete, patent from an oval and PDA remain until after birth. Stage of development, the cardiogenic field appearance, two endocardial tube, the primary heart tube, and formation of five dilatation and cardiac loop, dilatation of cardiac loop, and development of various chamber. The cardiogenic area, primitive blood vessels, blood flow on the endocardial tube, 20 days. 21 days fusion with the primitive heart tube and truncus arteriosus bulbus cordis primitive ventricle, primitive atrium. On the 23 days, the truncus arteriosus bulbus cordis ventricle, atrium, sinus venosus formation. Cranial to caudal end, this folding of heart tube. And middle of the third week, aggregation, splanchnic mesoderm cell, cardiogenic area, the angioblastic cord that canalized to form two endocardial heart tube. The embryo fold in cephalocaudal and transversely, bringing the two heart tube closer. And two endocardial heart tube fuse to cephalocaudal direction. This truncus arteriosus bulbus cordis, conoventricular canal, primitive ventricle, atrioventricular canal, and primitive atrium and sinus venosus develop. The formation interatrial septum, the septum primum, septum spurium, and common atrial chamber. The atrioventricular cushion fusion after formation of interatrial septum. An interventricular septum, one muscular part, one membranous part. Muscular part in median muscular ridge grow upward from the floor of primitive ventricle towards the atrioventricular cushion. Interventricular foramen located between the pre-edge of muscular interventricular septum and fused atrioventricular cushion, which is close to the membranous interventricular septum. The proliferation and fusion of tissue from three sources they form membranous interventricular septum. And conducting system of the heart. When there are two heart tube, a pacemaker lies in caudal part of the left tube, and sinus venosus comes to lie near the opening of superior vena cava. The atrioventricular node atrioventricular bundle forms the left wall of sinus venosus and atrioventricular canal. Is cephalocaudal folding. Ventricle moves ventrally and to the right. The atrium moves dorsally to the left. And the left common cardinal vein is obliterated at 10 weeks, and as a result, left to right shunt of blood, left sinus horn and vein enlarge greatly. And formation of ventricular septum. The truncacytosis form the aorta pulmonary trunk, bulbous cord is smooth part of right ventricle, conus arteriosus, smooth part of ventricle, aortic vestibule, primitive ventricle, trabeculated part of right ventricle and trabeculated part of left ventricle, primitive atrium, trabeculated part of right atrium, trabeculated part of left atrium, sinus venosus, smooth part of right atrium, sinus venorum, coronary sinus, oblique vein of left atrium. Formation. The fetal circulation. From fertilization to primitive heart to abnormal development at this stage, embryogenesis results in embryonic death because of critical nature of early circulation of future growth. Thank you for listening. Thank you.